So now we are discussing the chronic hepatitis. I talked about the acute hepatitis A. Okay, now I'm going to discuss the chronic hepatitis, hepatitis B, hepatitis C, okay, and D and E hepatitis also. But what I'm going to discuss are hepatitis B, hepatitis C in the next video, and Wilson and autoimmune hepatitis. Okay, so in this video I'm going to discuss hepatitis B, epidemiology, definition of course, and mode of transmission of hepatitis, the diagnosis of hepatitis B, serology of hepatitis B, which is a complicated subject. I'm going to make my best to simplify it, okay, and I will end up with the management of hepatitis. So let's start with the definition of hepatitis B. What is hepatitis B virus? It is a member of Hepatnaviridae. Okay, so hep for hepatitis, it is a DNA virus. Okay, so you can remember it is a DNA. Hepatitis A virus is a RNA virus. Okay, hepatitis B is a DNA virus. This is the big family of hepatitis B. Okay, it has a circular double-stranded DNA, as you can see here. Okay, it's circular or semicircular double-stranded DNA. Okay, in hepatitis B we have 4 genes that have been identified in this hepatitis. Okay, we have what we call the surface gene, the core gene, and the P polymer gene and other genes. Okay, the surface gene encodes what we call the surface antigen. This is the surface antigen of hepatitis B virus. Okay, so this is the structure that we call the surface antigen of hepatitis B. So this is the surface antigen, which is encoded by the surface gene. The C or the core gene encodes the core antigen. Okay, hepatitis B core antigen. You can see the blue thing here is the core antigen of hepatitis B. Okay, and the P encodes the DNA polymerase. Actually, we have 3 important antigens that wherever you read about hepatitis B you will find. Okay, you'll find the hepatitis B surface antigen I told you about, the hepatitis B core antigen, and the third important one is a result of self-cleavage of hepatitis B core antigen. Okay, it is the hepatitis B envelope or ELI antigen. So from outside inside you can find here the hepatitis B surface antigen. The blue thing is hepatitis B core antigen, and as a result of an cleavage of the hepatitis B core antigen, the black dots here that you can see are the hepatitis B envelope or ELI antigens. Okay, so these are the 3 important antigens that are very important markers of hepatitis C. I'm going to talk about them in serology of hepatitis C. Okay, hepatitis C core antigen or P core antigen, sorry, is the inner surface of the viron. Okay, so and the function of the hepatitis B core antigen is to encode the virus and the DNA. Okay, so just remember the 3 antigens. The hepatitis B virus actually replicates in the liver mainly. The main site of hepatitis B replication is the liver, may also replicate in the lymphocytes, in spleen, in the kidney, in the pancreas. Okay, but the liver is most important. Incubation period of hepatitis B virus is 6 weeks to 6 months, about 6 weeks to 6 months. Now let's move to the epidemiology of hepatitis B virus. Actually, this graph is by the WHO organization. Okay, the World Health Organization. The red thing here on the world map is associated with the high prevalence of hepatitis B virus. You can find it here in the sub-Saharan Africa, in China, parts of Middle East, in Asia. The hepatitis B virus is common in these places. Okay, so it's part Middle East, China, sub-Saharan Africa, and so on. And now let's move to, after the epidemiology, this is all I want to tell you about the epidemiology. Let's move to the mode of transmission of hepatitis B virus, like hepatitis C transmitted by blood or body fluids. The most important route of transmission is by blood or body fluids. Okay, sexual transmission is possible also. Okay, so how by blood or body fluid? Parenteral transmission. Okay, very important move transmission is perinatal transmission. Okay, so now let's start with the blood or body fluid transmission, maybe due to intravenous drug administration or blood products. Okay, you can find the hepatitis B virus in about 0.1 to 1% in donors of blood. Okay, so this is by blood or body fluids, drug addicts and so on. Okay, perinatal transmission is what concerns us here, because we are talking about pediatrics hepatitis B. The most important risk factors associated with perinatal transmission of hepatitis B is the presence of maternal hepatitis B E antigen. You remember I told you that we have the hepatitis B E antigen, the black dots here. The presence of hepatitis B E antigen is an indicator of the presence of highly infectious hepatitis B virus. Okay, the status of infectivity of hepatitis B virus. So the presence of hepatitis B E antigen is associated with 90% hepatitis B risk versus about 20% just risk in non-hepatitis B E antigen patients or mothers. Okay, also the presence or the infection of hepatitis B in the third trimester is associated with more risk to develop the hepatitis B in the child. Okay, the presence of hepatitis B DNA in maternal blood that indicates the active status of hepatitis B is also associated with high risk factor of child being infected with hepatitis B. Also, if we have hepatitis B surface antigen in the cord blood or in some siblings, maybe the brother of the child may be affected with hepatitis B, so the presence of hepatitis B surface antigen in the cord blood, sibling and so on raise the susceptibility to having hepatitis B in the baby. Okay, so these are very important points to remember in perinatal hepatitis B infection. So if I ask you what are the risk factors that increase the susceptibility of the child to have hepatitis B due to perinatal infection, or the mother that is infected, you will answer that the there is a maternal hepatitis B envelope antigen. Okay, or the infection in the third trimester, presence of hepatitis B surface antigen in the cord blood, or in the sibling, presence of brother that is infected, or and so on. Okay, or DNA maternal blood. So I'm going to talk about the envelope antigen, the surface antigen, DNA in minutes. Okay, also hepatitis B may be sexually transmitted. Okay, but it is present in moderate concentration in the semen. I'm going to tell you this. Okay, so is more transmitted via blood or body fluids. So how does the hepatitis B spread or transmitted perinatally? Okay, transmitted infection occur at birth or transplacentally, maybe in birth canal. Okay, or transplacentally. Okay, so in infants that have hepatitis B that was transmitted to them from their mothers, okay, the serological markers may appear after 1 to 3 months. So if you examine the neonate or the infant, you may find the negative serological markers of hepatitis B, okay, because it will develop after 1 to 3 months. Mostly the neonates of hepatitis B mother, the affected neonates of course, are asymptomatic, and this is due to the immature immunity. So the symptoms of hepatitis B are due to the immunity of the baby. They will have the immunity will attack the hepatitis B virus, and this will lead to jaundice and the symptoms of hepatitis B. Okay, so in neonates we have still immature immune system, or relatively immature immune system, so mostly the neonates will be asymptomatic. Okay, but most of them will go into a chronic hepatitis B, and again this is due to the same cause, the immature immune system. So if the child is younger, then the susceptibility to have a chronic infection is more, but the symptoms are less. Okay, so most of them are hepatitis B surface antigen positive. Okay, they will go into chronic infection and mostly into what we call immune tolerance hepatitis B. I'm going to discuss that in minutes. Okay, only 5% of the childs that had the hepatitis B perinatally will resolve. Okay, so in opposite, if we have an older child, the more it is associated with more recovery and less recurrency. So this graph will just explain what I'm talking about. Here we have the age of infection, okay, and the chronic or the chronicity of infection. If you have an infection at earlier ages, okay, you will have very high chronicity rate. So at birth we have the most chronicity rate, and then it will be less and less and less and less with age. With increasing age we have less chronicity, the red line here. Okay, less chronicity, but we have increase in symptoms. So if the patient is older, it will develop more symptoms because we have more mature immune system. Okay, but we will have less chronic infection. So I hope it is clear now. Okay, so this is about the perinatal infection. Okay, hepatitis B virus is high in the blood, in the serum, in the wound exudates, moderate in the semen, in the vaginal fluid. So the blood transmission or body fluid transmission of hepatitis B is more than the sexual transmission of hepatitis B. In the next video I'm going to talk about the serology of hepatitis B.